Patients with Lambert-Eaton myasthenic syndrome, or LEMS, have reduced neuromuscular signaling due to the presence of autoantibodies directed against voltage-gated calcium channels in the presynaptic motor neuron. These autoantibodies impair calcium influx during an action potential. Reduced intracellular calcium limits presynaptic vesicle fusion and release of acetylcholine across the neuromuscular junction. However, presynaptic stores of acetylcholine and the postsynaptic response to acetylcholine remain intact. Disrupted acetylcholine transmission reduces activation of acetylcholine receptors on the muscle fiber. Patients with LEMS experience diminished muscle fiber contraction and muscle weakness due to reduced acetylcholine transmission. Neuronal repolarization due to potassium efflux occurs as normal, ending the action potential before sufficient acetylcholine has been released.